Hello everyone. This is case 3 of the Panoramic Interpretation series for the summer seminar course at the University of Minnesota School of Dentistry. In this video, we are going to review a single panoramic radiograph of a young patient with fibrous dysplasia. Dr. Raj Gopalakrishnan had given this radiograph. As we had seen before you start interpreting a panoramic radiograph, evaluate if the patient positioning is correct. A panoramic radiograph can have many kinds of positioning error. As we can see, the second right molar is slightly wider than the left side. This means that the right side is slightly further away from the sensor. Similar widening is also seen on the mandible. I'm not trusting the data of the mandible as much because there might be some expansion of the jaw and displacement of the teeth. Other than this rotation error, this panoramic radiograph is very good for interpretation. We have although missed the chin. The tongue is mostly in contact with the hard palate. The linear band and the oval radiopacity that we see are part of the head positioning guide. The shape of this guide varies from machine to machine. So this is how this unit looks like, and this is the head positioning unit, a straight rod with a circular device. Coming back to the radiograph, I can see that the deciduous right second molar is retained. The premolars are impacted and distally tipped. These two teeth are inferiorly displaced. The trabecular pattern in this area is grainy. A good trabecular pattern is seen on the mandibular left premolar and molar region. These are almost horizontal, thin radiolucent lines. If you take a fine pencil, you should be able to draw these lines. On the right side, you are not able to draw these trabecular patterns. These are grainy. Some textbook will describe this as ground glass appearance. The extent of this condition is difficult to describe. It extends from the alveolar crest to the inferior border of the mandible. I cannot really tell you what are the mesial and distal extents of this condition. This is one of the features of fibrous dysplasia, that border blends into the neighboring bone. There is no cortical margin of fibrous dysplasia. We can see that the inferior alveolar canal is displaced to the inferior border of the mandible. In many cases, you will see that the canal is actually displaced superiorly. Also note that the crowns of the premolars are much wider than the left premolars. This also means that the right premolars are displaced lingually in addition to being displaced inferiorly. Fibrous dysplasia can be two types, solitary or monostotic, involving only one bone, and polyostotic or multiple, involving several bones. Fibrous dysplasia is most commonly monostotic, about 70% of the cases. It can be in other bones other than the jaws. The polyostotic fibrous dysplasia usually starts under 10 years of age. The solitary variety is seen a few years later in life. The McCune-Albright syndrome is mostly in females. The identification of fibrous dysplasia is from an observation of facial growth. Usually there are no signs and symptoms. Due to the pressure from the expanding bones, there may be neurological symptoms. If the fibrous dysplasia is near the optic canal, it can lead to blindness. In the craniofacial regions, fibrous dysplasia is twice more common in the maxilla, usually only on one side. As I had shown in the image, the border of the fibrous dysplasia blends into the neighboring bones, so there is no defined radiographic border. The trabecular bones, as we had seen, are grainy. As we have seen, teeth in the area of fibrous dysplasia are often displaced. The cortical plates would be expanded. Typically, the inferior alveolar canal is often displaced superiorly. In our case, the canal was displaced inferiorly. The irregular bony pattern, similar to fibrous dysplasia, is also seen in other conditions. Such findings can be due to systemic diseases. If it is a systemic disease, you will find the radiographic features on both sides of the jaws, bilaterally and in other bones as well. Paget's disease can have similar findings. Fibrous dysplasia is a condition of children. Paget's is a condition of the older people. Periapical segmental dysplasia can also have similar radiographic findings. Again, periapical segmental-osseous dysplasia is a condition of middle-aged females, while fibrous dysplasia is seen in children. Also, periapical segmental-osseous dysplasia is limited in the periapical region. Fibrous dysplasia can be easily diagnosed radiographically. If the fibrous dysplasia is in the base of the skull or in the area of neurovascular canals, cross-sectional imaging may be helpful in understanding any compression on the neurovascular canals. For treatment, orthodontic or cosmetic surgery may be needed. These treatments can be delayed after skeletal maturity, when the growth of the fibrous dysplasia usually slows down. The use of oral contraceptive or hormonal changes may trigger the growth of the fibrous dysplasia again. Come on, thank you. Please join me on different panoramic interpretation video